Starting your baby on solid food is a very exciting time. Along with the excitement, however, come many new questions and concerns. Most babies start solid food between 4 and 6 months of age. Key things to look for to know that your baby is ready for solids include his or her ability to control the head and neck well, if your baby has doubled his or her birth weight, shows signs of fullness like turning the head away from you or a bottle, and if your baby watches with interest as you eat, perhaps even opening his or her mouth and leaning forward as if to ask for a bite. Be sure to consult with your pediatrician if you're unsure whether your baby is ready to begin solids. Remember, mealtimes are a great opportunity to have fun and communicate with your baby, but they may get messy too. At this age, many babies are teething and they like to bite down on objects to soothe their swollen gums, so use a soft tip infant spoon to feed your baby. Always make sure the baby is upright during feedings and never leave your baby unattended when he or she is eating. Start with 1 tablespoon of organic cereal mixed with 3 to 4 tablespoons of breast milk or formula to reach the desired consistency. Early on, it's recommended that you try to mix to a more liquid consistency until your baby gets a feel for eating solids. Then over time, you can make it a little thicker. Place a small amount of cereal in your baby's mouth. There are 2 common behaviors that occasionally occur when babies are learning to eat. One is called tongue thrust, where your baby may push the cereal out with his or her tongue, which is baby's way of controlling his or her mouth muscles. The other is called gag reflex, where food hits the back wall of the throat and is not swallowed. This reflex gets the baby to hold his or her breath and cough the food forward, away from the trachea or air pipe. The gagging reflex blocks food from entering the air pipe and therefore prevents choking. As the baby gets more experience eating solid foods, these 2 behaviors will diminish, so just be patient. At this stage, baby will still be getting much of his or her nutrition from breast milk or formula in a bottle. It's important for them to distinguish between bottle and solid foods, so do not put cereal into your baby's bottle unless this is specifically recommended by your doctor for digestive reasons. The first food is usually infant cereal fortified with iron, which is critical to baby's growth and development. First foods can also include single organic vegetables and fruits. Discuss with your pediatrician if your baby requires additional nutrient supplementation beyond what he or she is getting from the diet. Rice cereal is usually the first grain, as most infants easily tolerate it. If your baby should occasionally become constipated, the rice cereal can be changed to oatmeal, which may help tiny tummies as it's less binding. If your baby experiences regular constipation, please consult with your pediatrician. Once you know that your baby can tolerate rice cereal, you can try other varieties. Remember, it's a good idea to wait a few days before introducing new foods to watch for signs of food sensitivities or allergies like rash, swelling, or digestive discomfort. Seek medical advice and know your family history if you think that your baby may have a food sensitivity or allergy. Be sure to have your camera ready for this exciting milestone in your baby's life.